Take a look at the map of the countries across the globe with confirmed cases of the virus. New today, Brazil with its first confirmed coronavirus patient. It's the first case in Latin America. That person had traveled to Italy before returning home to Brazil. Now, there are no confirmed cases here in Connecticut, just one in New England, and that happened in Massachusetts.
Now, we're not at this point yet, but here's what the CDC recommends if the outbreak does grow into the U.S. They recommend people limit their travel and, in fact, limit long meetings, which should make some people happy. Employers should be prepared to allow employees to work from home, be ready to close schools and or allow students to work from home. And that means parents might want to start thinking about child care ramifications. Hospitals might need to delay elective surgeries just to keep unnecessary patients out of harm's way. As we wait for the president, we want to play you the update from Governor Ned Lamont after meeting with his team late today.
I think we're first going to go over to Dr. Bannock over here, who has joined us now to talk a little bit more as we're waiting for the president to talk. You know, tell me a little bit about what you're expecting the president to say, because we've obviously heard from Governor Lamont here in Connecticut today. We've heard a lot about this, you know, from nationally. What are we expecting to hear from the president? I'm
hoping that the president will give some insight into the preparedness process that's underway. You know, the CDC has been very vocal. They've provided a lot of communication regarding what they're doing to prepare, as well as the guidance that they're giving to local and state health departments and healthcare facilities to prepare. So I expect the president to strengthen those recommendations and support the recommendations that are made by public health officials.
Up until this point, the efforts at the federal level have been largely to catch people coming into the country who've traveled abroad and might have been exposed to coronavirus, quarantining them and so on. As we look ahead then to the possibility of the coronavirus beginning to spread inside the United States, what are the kinds of things the federal government should be looking at?
So I think a lot of the guidance thus far, as you mentioned, has been geared towards preparing the containment phase, so trying to avoid introducing virus or at least localized spread in the United States. But now we're looking at preparing for a potential next phase of local transmission within the community. And a lot of the recommendations would be those basic hygiene measures, really how to best prepare yourself on an individual level, and then thinking more broadly along the lines of what you mentioned earlier, you know, how do we avoid exposing large groups of individuals, thinking about the possibility of things like school closures, avoiding mass gatherings, kind of the broader community-based interventions that we would need to reduce the transmission within the community.
I know it seems so simple, and I feel silly to have to say this over and over again, but what are the ways that we need to make sure that we're keeping ourselves and our families healthy? So
on an individual level, you know, hand hygiene, washing our hands, either with water or alcohol-based hand sanitizer is really key. You know, the droplets can spread both from person to person through respiratory or coughing droplets, as well as through direct contact and then touching your face. So really being adamant about hand hygiene and cautious from that approach. Trying to avoid staying away from people who look like they might be ill. And then, of course, if you do develop symptoms, trying to protect others and sort of keeping yourself away from large groups to prevent spread in the, amongst the community.
I'd like to get your comment on something that I saw online today, and if I saw it online, a lot of people saw it online, but basically we're hearing about this run on surgical masks really kind of around the world, but what I saw today said really the time to put on a surgical mask is when you've been infected with it, so you don't infect others, but in fact it won't keep the virus out.
Right. So you know, on a day-to-day basis, wearing a surgical mask when you're out in public is not something that's currently recommended. You know, situations we do think about it, like in healthcare settings when we're thinking about close contact with patients who may be sick and using that surgical mask as a potential barrier. And then, you know, if you are sick yourself, for instance, if you go into a crowd or even into a healthcare facility, you would be given a mask to try to prevent spreading virus or whatever organism throughout the waiting room area or into the healthcare facility.
We do want to listen in now what Brent was talking to earlier. Just listen to the governor and what he had to say about how Connecticut is prepared to handle an outbreak here.
But I just wanted you to know what we've been doing here in the state of Connecticut. Yesterday, the CDC, Center for Disease Control, upped the ante to the degree to which they said we've moved from a position of containment of the virus to mitigation. And that means we've got to be ready for the fact that it could be coming to our shores in a more aggressive way. And I want you to know that here, meeting with the Unified Command, all of our healthcare professionals, talking today with all of the folks from the hospitals to our DEEP to all of our different commissioners, Connecticut is ready. And we've been ready for a while. It was just last August that we did a test right here at the Operations Center, ready for the possibility of a pandemic. What this means in terms of a unified command is you've got state government working together on a coordinated basis and making sure we can provide all the support we can for our hospitals and our healthcare providers, making sure that they're ready to get all the supplies and personnel they need depending on what could happen going forward. This thing is breaking fast. You probably, know was really just detected a couple of months ago. Found out that there was person-to-person contact contagion just a month ago. And we've been meeting on this every day. Our Commissioner of Public Health is down in Washington, D.C. right now. And we're doing this on a very coordinated basis. But you should know that things are changing on a daily basis. So I want you to know that you can always go to ct.gov, ct.gov. We have all the information related to schools, related to public health, related to everything we're getting from the hospitals, related to CDC in one place. And I think that's important.
All right, the president is approaching the podium. Let's listen in to what he has to say.
Extend my deepest condolences to the victims and families in Milwaukee, Wisconsin. Earlier today, a wicked murderer opened fire at a Molson Coors Brewing Company plant, taking the lives of 5 people. A number of people were wounded, some badly wounded. Our hearts break for them and their loved ones. We send our condolences. We'll be with them. And it's a terrible thing, terrible thing. So our hearts go out to the people of Wisconsin and to the families. Thank you very much. I've just received another briefing from a great group of talented people on the virus that is going around to various parts of the world. We have, through some very good early decisions that were actually ridiculed at the beginning, we closed up our borders to flights coming in from certain areas, areas that were hit by the coronavirus and hit pretty hard. And we did it very early. A lot of people thought we shouldn't have done it that early, and we did, and it turned out to be a very good thing. And the number one priority from our standpoint is the health and safety of the American people, and that's the way I viewed it when I made that decision. Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads. As most of you know, the level that we've had in our country is very low, and those people are getting better, or we think that in almost all cases, the better are getting. We have a total of 15. We took in some from Japan. You heard about that, because they're American citizens and they're in quarantine. And they're getting better too. But we felt we had an obligation to do that. It could have been as many as 42. And we found that it was just an obligation we felt that we had. We could have left them, and that would have been very bad, I think, American people. And they're recovering. Of the 15 people, the original 15, as I call them, 8 of them have returned to their homes, to stay in their homes until fully recovered. 1 is in the hospital, and 5 have fully recovered. And 1 is, we think, in pretty good shape. And it's in between hospital and going home. So we have a total of, 15 people, and they're in a process of recovering, with some already having fully recovered. We started out by looking at certain things. We've been working with the Hill very, very carefully, very strongly. And I think we have very good bipartisan spirit for money. We were asking for $2.5 billion, and we think that's a lot. But the Democrats and I guess Senator Schumer wants us to have much more than that. And normally in life I'd say, we'll take it. We'll take it. If they want to give more, we'll do more. We're going to spend whatever's appropriate. Hopefully we're not going to have to spend so much because we really think we've done a great job in keeping it down to a minimum. And again, we've had tremendous success beyond what people would have thought. Now, at the same time, you do have some outbreaks in some countries. Italy and various countries are having some difficulty. China, you know about where it started. I spoke with President Xi. We had a great talk. He's working very hard, I have to say. He's working very, very hard. And if you can count on the reports coming out of China, that spread has gone down quite a bit. The infection seems to have gone down over the last 2 days. As opposed to getting larger, it's actually gotten smaller. In one instance where we think it's somewhat reliable, it seems to have gotten quite a bit smaller. With respect to the money that's being negotiated, they can do whatever they want. I mean, we'll do the 2.5. We're requesting 2.5. Some Republicans would like us to get 4, and some Democrats would like us to get 8.5. And we'll be satisfied whatever it is. We're bringing in a specialist, very highly regarded specialist, tomorrow, who works actually at the State Department. Very, very tremendously talented in doing this. I want you to understand something that shocked me when I saw it, that I spoke with Dr. Fauci on this, and I was really amazed, and I think most people are amazed to hear it. The flu in our country kills from 25,000 people to 69,000 people a year. That was shocking to me. And so far, if you look at what we have with the 15 people, and they're recovering, one is pretty sick, but hopefully will recover. But the others are in great shape. But think of that, 25,000 to 69,000. Over the last 10 years, we've lost 360,000. These are people that have died from the flu, from what we call the flu. Hey, did you get your flu shot? And that's something. Now, what we've done is we've stopped non-U.S. citizens from coming into America from China. That was done very early on. We're screening people, and we have been at a very high level, screening people coming into the country from infected areas. We have in quarantine those infected and those at risk. We have a lot of great quarantine facilities. We're rapidly developing a vaccine, and they can speak to you. The professionals can speak to you about that. The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly, a vaccine for the future, and coordinate with the support of our partners. We have great relationships with all of the countries that we're talking about. Some it's a fairly large number of countries. Some it's one person, and many countries have no problem whatsoever. And we'll see what happens. But we're very, very ready for this, for anything, whether it's going to be a breakout of larger proportions or whether or not we're at that very low level. And we want to keep it that way. So we're at the low level. As they get better, we take them off the list, so that we're going to be pretty soon at only 5 people. And we could be at just 1 or 2 people over the next short period of time. So we've had very good luck. The Johns Hopkins, I guess it is a highly respected, great place. They did a study, comprehensive, the country's best and worst prepared for an epidemic. And the United States is now, we're rated number 1. We're rated number 1 for being prepared. This is a list of different countries. I don't want to get in your way, especially since you do such a good job. This is a list of the different countries. United States is rated number 1, most prepared. United Kingdom, Netherlands, Australia, Canada, Thailand, Sweden, Denmark, South Korea, Finland. This is a list of the best-rated countries in the world by Johns Hopkins. We're doing something else that's important to me because he's been terrific in many ways, but he's also very good on health care, and we really followed him very closely. A lot of states do. When Mike was governor, Mike Pence of Indiana, they've established great health care. They have a great system there, a system that a lot of the other states have really looked to and changed their systems. They wanted to base it on the Indiana system. He's very good. And I think, and he's really very expert at the field. And what I've done is I'm going to be announcing exactly right now that I'm going to be putting our Vice President, Mike Pence, in charge. And Mike will be working with the professionals, doctors, and everybody else that's working. The team is brilliant. I spent a lot of time with the team over the last couple of weeks, but they're totally brilliant, and we're doing really well. And Mike is going to be in charge, and Mike will report back to me. But he's got a certain talent for this, and I'm going to ask Mike Pence to say a few words, please. Thank you, Mike.
Thank you, Mr. President. President Trump's made clear from the first days of this administration we have no higher priority than the safety, security, health, and well-being of the American people. And from the first word of an outbreak of the coronavirus, the President took unprecedented steps to protect the American people from the spread of this disease. He recounted those briefly, but the establishment of travel restrictions, aggressive quarantine effort of Americans that are returning, the declaration of a public health emergency, and establishing the White House Corona Task Force are all reflective of the urgency that the President has brought to a whole-of-government approach. As a former governor from the state where the first MERS case emerged in 2014, I know full well the importance of presidential leadership, the importance of administration leadership, and the vital role of partnerships of state and local governments and health authorities in responding to the potential threat of dangerous infectious diseases. And I look forward, Mr. President, to serving in this role, bringing together all the members of the Corona Task Force that you've established, HHS, CDC, DHS, the Department of Transportation, and State. This team has been, at your direction, Mr. President, meeting every day since it was established. My role will be to continue to bring that team together, to bring to the President the best options for action to see to the safety and well-being and health of the American people. We'll also be continuing to reach out to governors, state and local officials. In fact, in the recent days, the White House met with over 40 state, county, and city health officials from over 30 states and territories to discuss how to respond to this, to the potential threat of the coronavirus. We'll be working with them in renewed ways to make sure they have the resources to be able to respond. And as the President said, we'll be adding additional personnel here at the White House to support our efforts on the President's behalf. We'll also be working with members of Congress to ensure that the resources are available for this whole of government response, and we'll be working very closely with Secretary Azar and his team that have done an outstanding job communicating to the public to ensure the American people have the best information on ways to protect themselves and their families, and also that the public has the most timely information on the potential threat to the American people. Mr. President, as we've been briefed, while the threat to the American public remains low of a spread of the coronavirus, you have directed this team to take all steps necessary to continue to ensure the health and well-being of the American people. And the people of this country can be confident that under your leadership, we will continue to bring the full resources of the federal government in coordination with our state and local partners to see to the health and well-being and to the effective response to the coronavirus here in the United States of America. With that, the President's asked me to recognize the Secretary of Health and Human Services, Alex Azar, and also the Deputy Director of CDC, Dr. Ann Shaka, for remarks. Secretary.
Well, thank you, Mr.
All right,
Vice
there you have it
President.
there. Vice President Mike Pence wrapping up after we heard from President Trump that the risk remains low here in the U.S. We do have 15 confirmed cases, but again, the government taking steps to make sure that we stay on top of the potential for an outbreak here.
And we had seen advanced word that the president would name a so-called coronavirus czar. That is Vice President Mike Pence. And the president speaking very highly of things that enacted in Indiana when Mike Pence was governor there. So we have Dr. David Bannock here still with us from UConn Health. And one of the things the president did was put things in perspective in comparison to the flu. And we were talking about this in the newsroom earlier today. Coronavirus, it was talked about in very scary terms. And yet the number of people who die from influenza in the United States every year dwarfs what we're looking at from coronavirus so far. So put it in perspective for us.
So I think that is an important perspective to take. When we think about the influenza season, there is a lot of mortality associated with it every year. Some years are worse than others, and this year is no exception. In fact, this year it's been quite a severe flu season. I think the coronavirus does get a lot of attention because there's a lot that we don't know about it, and unfortunately, unlike the flu, there's no vaccine really that's out there to protect us. So I think those factors do generate concern, and the concern I do think is appropriate. But I agree with the perspective that at this point in time, the risk of flu and its consequences is higher. Though, we do have to be attentive to what may lie ahead, which may change.
Well, I suppose, fortunately, the way you approach both of those things is the same way in terms of protecting yourself.
Right, exactly. We do the simple things like wash our hands, make sure that you're not staying around people that have a sickness,
Cough into your elbow.
Right,
and
exactly,
so on.
whether it's a cold or the coronavirus or the flu. One thing that you had mentioned, there is no vaccine. We heard the president say that the United States is developing a vaccine that could happen quickly, but there is kind of a little bit of a longer timeline to that. I had heard at least not for another year.
Yeah, I think it's hard to really pinpoint that. Right. There is certainly active investigation to develop a vaccine that's really happening underway, and how accelerated that will be is hard to know. Mm-hmm. But the vaccine development process does take time, not just actually creating the vaccine, but the testing and all of those processes, evaluating its safety. That does take some time, so I think we have to be mindful of that.
We had understood, though, that the vaccine that they're testing is one that began being tested for SARS, which is another coronavirus, we understand. And so it was something they were already working on, and perhaps that will speed up the development in this case.
Yeah, I think that's something to consider. Both of them are coronaviruses. They are different in their actual structure, but there may be some overlap in terms of the types of technologies that are used. I think the other feature that's key about this virus is that we're able to really rapidly sequence it, much faster than in previous outbreaks. And that rapid sequencing and understanding kind of the characteristics of the virus at the genetic level really helps facilitate the development of things like testing and vaccines. So that is an advantage that we have now compared to 20 years ago.
All right. Well, we have some numbers we want to put up on the screen here, Doctor. A lot of people have asked how deadly, in fact, is COVID-19, which is the official name for what we're calling the coronavirus, and have all along. According to the Chinese government, 2.3% of people infected in China have died, and you compare that with the flu here in the U.S., where about 0.5% to 1% of flu patients die. Those numbers jive with what you understand?
Yes, that seems consistent with what's been reported so far. I think when we start thinking about the mortality rate of COVID-19, we do have to take that with a grain of salt. We're seeing sort of only potentially the early phases of what's developed in China, but I think that story is still unfolding. So those are the numbers that the WHO has been reporting, and they do update their statistics every day globally. So I think that's what we have to go by, but those numbers could potentially change over time.
I also just want to take it back one more time to here in Connecticut, because we heard the president addressing this nationally, but we also heard Governor Lamont addressing it locally here and saying that the state is prepared. You are from UConn Health. What steps are hospitals taking to make sure that in case we do see an outbreak here, we can handle it?
So, that's really critical. And just like the state has ongoing preparedness activities, so do hospitals throughout the state. So, at UConn Health, we have our ongoing emergency emergency preparedness program that we build on our experiences from previous outbreaks. So thinking about SARS, even Ebola a few years ago, we take that information and we help enhance our own emergency preparedness. With COVID-19, some of the things that we're really focusing on is rapid identification and isolation of potentially infected patients. So being able to really identify those patients quickly at the point in which they would enter a facility, either based on their symptoms plus their exposure history, and then identifying that patient and putting them into an area where they're away from other patients, and also providing the education and training to our healthcare staff in taking care of that patient. Sort of what are the special precautions that need to be taking place? What's the special personal protective equipment that our healthcare providers need to use when taking care of those patients to prevent them from getting sick?
Let me ask you about this. I mean, much has been made of the president's suggestion that the coronavirus will begin to go away when the weather warms up. That happens with influenza. There is a flu season in the winter months. Can we look forward to any relief when the weather warms up, or is because this is a global thing, the weather is changing around the globe all the time? What is the truth?
I mean, that seems optimistic, but whether or not that's actually going to pan out, I think still remains to be seen. You're correct. With flu and other respiratory viruses, we do see them peak in the wintertime. Then as the weather warms up, we see fewer cases. Coronavirus, this particular situation with COVID-19 is very new. So I think it can be difficult to predict exactly how it's going to unfold. I think thinking that it's going to get better in the warmer months would be optimistic, but I think we do need to prepare that for ongoing transmission well into the spring and even beyond that.
All right, Dr. Banik, thank you so much for joining us and being here as we listen to President Trump. We are going to have even more tonight on the Fox 61 News at 10 and 11. Of course, you can always also get updates on our news app.
Thank you for joining us for this special report, and we'll see you tonight at 10.